You are listening to the Spine Whisperers podcast. Please know that our doctors are here to only educate, not diagnose on this podcast. If you have any questions, please feel free to find us at www.mfwellness.org. Good afternoon. This is Dr. Matthew Fink with Dr. Joshua Fink and Dr. Brad Maurer.
What's up?
On today's podcast, we're going to talk a little bit about the new therapies that we're doing here, but also some of the old therapies that we really haven't talked that much about. Mm-hmm. So we're going to be talking
because
about...
we can't get the people doing them to talk. We have to
Well,
trap them.
I think I have stuff scheduled so that I'll have both representatives in to talk about their effective field.
Okay. Because it's going to be like a prelude, right, to them?
Yeah, it's a prelude because...
It's a pre-meeting meeting?
Yeah, it's a pre-meeting meeting.
We're going to give us
with the Bobs.
And they're going to give the full rundown.
They're going to come in and completely contradict everything we said.
We're totally going to have
Yeah. It's like the only thing we have right is the names. Yeah, so acupuncture.
It's like they're somewhere touching the thermostat.
Cupping.
We're going to show up.
Taping. Scraping. First couple ones, I'm going to be talking about scraping and why it's so important with a lot of our college athletes and people that have already that are going the professional route, and why the growth of muscle and the strains that happen when that happens, and why scraping has such a big effect on it. And then the other thing is taping. So I got the INGs.
Nice.
So when we look at scraping and we determine who needs scraping and why it's being done, we look at overall what the injury was, how intense the injury was, and if the injury is getting better. So we can scrape ligaments, muscles, the IT band, which is basically that band that runs from the hip down to the knee. It's a little bit more sensitive than other areas, and it kind of falls in line between ligament and like elastic tissue, because it is actually attached to muscle, the tensor fasciae lata, that actually the IT band connects to that, and that's where you get the tightness from. So why do we care about scraping? Scraping helps bring blood from your body to the tissue site. And we know that if there's more blood available, there's a greater chance, a greater healing factor present. So the same thing applies to when we're doing laser as well.
Yeah, myofascial release as well. You're going to warm up the tissue, and then you want hyperemia. You just want more blood than normal there to bring the good stuff. But not too much.
Yeah.
Because then it gets a little crazy.
Yeah, now scraping, if you've seen scraping being done in the office, it is a little intense. It has a direct impact to the tissue site.
It's extraordinarily painful.
Yeah, on some areas.
Yeah,
some issues. Yeah, so some areas it's different.
Yeah.
We don't always believe in no pain, no gain. But
that's right.
With scraping...
Pain plus gain.
Equals gain.
Scraping will fix you in one visit, and that's because you'll lie to us and say it's better, so we don't.
Yeah. You look at my shoulder, and it's like you don't have a shoulder anymore.
Hey, how's your shoulder?
Bionic, yeah.
Oh no, don't worry about that.
It's
like,
great.
well, you sure it was a 13-year injury? No, man, don't worry about it. Okay. Then we squeeze their shoulder.
Yeah.
Buckle their knees.
Now, when we talk about taping, the other ING, that is actually supportive therapy for regular injuries and also pregnancy. Now, Dr. Drum has used on different occasions taping to help support the pregnant belly while we're going through the different trimesters of growth. So the reason why that's important, because it helps alleviate a lot of that frontal pain or the feeling like the baby is kind of weighing you down or walking forward with it. So taping is really, really important when we get to the point of having that support. Just like you'll see a bodybuilder and weightlifter use the weight belt to help secure and support their body while they're weightlifting. That's why they do that. It's not because they're going to wear it all the time. It's just for us, for taping. It's a couple days, or as long as you can keep it on. you crisscross the tape from hip to upper abdomen, and it just lays right on there. And what that does is it pulls that muscle tissue and that skin away and lifts it up throughout that entire length of the tape. The other taping aspect is
it's like when you tape a room, you're going to paint it. You got to take the paint off. You got to take the tape off that way.
It's the corners.
You got to take the tape off at 45 degrees.
It's true.
If you're amazing, you pull it off at 90. But
if you've seen beach volleyball, the taping for injuries are taped to support the biceps and usually low back of volleyball players. You'll see that a lot in beach volleyball. Because you can actually see it because most of the beach volleyball people...
They're not wearing any clothes.
They're not wearing any clothes.
Yeah. Sometimes you're like, God, I wish they would get some more tape. Like, what you need is a lot more tape.
Yeah.
And maybe a shirt.
Yeah.
You know what I'm saying?
But you'll see that more often because you can actually see the tape on the person's body.
Yeah, you can see the tape working. You can see the muscles pulsing.
Yeah.
You're like, oh, God. You're like, oh, that's working really well.
But yeah, so those are the two INGs of what's going to
the old scrape and tape.
Yeah, what's going to be showing up at the office.
We call it an S&T.
Yeah.
Oh, nice.
And I think I have another ING.
Oh, is that true? Let's hear about your ING, bro.
Cupping.
Oh,
nice, bro.
And with cupping, I'll explain it, but it has a similar goal in terms of what we want to accomplish with it as the scraping. So the scraping, Dr. Matt was talking about, you have a metal instrument. Mm-hmm. You're really like working into that skin, bringing that blood to there. You're also kind of working potentially through some adhesions and some scar tissue.
Scar tissue especially.
Yeah.
It really breaks that up.
The cupping, though, you're going to find, what area needs it, whether it's the low back, whether it's shoulder, maybe if you remember Phelps.
Yeah, it's Phelps.
Michael Phelps.
I almost said Greg Louganis.
Well, he was a diver.
Do you know who that is?
I do.
Oh.
Diver. Remember him hitting his head on the
he
diving
did.
board that one
holy
time.
diver.
So cupping, if you can imagine, they're shaped like a cup, but they're kind of like a suction cup, big suction cup. And then there's a little device that once you put that cup on let's say we're dealing with the low back issue. You have it on the low back.
Yeah, if you're a parent, just think about it as a toilet plunger. Because if you're a parent, you've used a plunger.
Right. Just like a toilet plunger.
Except
or like,
you're not, you're pulling up the same stuff.
But kind of. So you place the cup on the area. Let's say it's a low back issue. Then you have this little device that basically sucks the air. It creates that suction on that area. And so what that's going to do is draw a lot of blood to that area. Mm-hmm. And you potentially in that area have what let's call it old blood that has a lot of debris in there. Yeah. So you're going to bring in that new blood. It's going to circulate through there. It also has healing factors, but not only that, it's going to take away all that old debris, all that old stuff.
Yeah, it's like halfway to leaching. The tympanists, your old timey bloodletters, they were like, you got some bad blood in there, and they'd start just letting that out. Incidentally, George Washington, that's what killed him, is that he caught a cold. Bloodletters were like, hey, you're good. We just let some blood out. You should be fine. He's like, you guys, I'm really sick. We got a lot to do. Let some more blood out. They were like, I don't know. He's like, come on. And so they did, and then he died.
There you have
That's a great presidential fact.
Yeah.
Yes. That will not happen with cupping, by the way.
Oh, yeah. No, that's right. It's controlled.
Yeah.
You're not letting any blood
It's
out.
not letting it
moving
out.
Into the skin where it'll be dissolved.
That's right. What you will have is a nice,
real good-looking bruise.
Circular, perfect circle bruise.
Like some sort of octopus got a hold of you.
Yeah, because with the suction-y cups.
And that'll last,
The giant Pacific octopus.
Ooh.
That's the biggest one.
Very nice.
It's one of the bigger ones.
That'll last about 2 to 5 days. So, it might be around.
Plus, you look cool.
Yeah. People ask you, what.
Yeah. I like to get
happened?
cupping right before, I have people over to swim. That way they look like I just got absolutely destroyed.
Yeah.
And
Like right on the side of your neck.
Bro, that's a hickey.
I don't even think they probably don't cup there, though, do they?
I mean,
It's a big,
I don't know. You tell us.
big blood vessels moving through their bros.
Yeah.
Maybe I could fake an octopus attack. People
Yeah.
like, what happened? Like, you wouldn't believe it.
Yeah, and I saw some of our cupping experts actually, as the patient was having cupping done, they were actually moving their appendages and their legs or their arms.
Yeah, they were having a
certain motion.
Which I had actually never seen before.
Like,
Yeah.
I
From
love
that
cupping.
flow and
Yep.
working through that.
Mojo.
working through the mojo.
Something
that might be the best word for
something
it.
that ends it out.
Yeah. They might have a different word, but when they eventually
there's often a
cupping basically helps work through the mojo.
Yeah, there's quite a different vernacular between the therapist and the therapy.
Yeah, sure.
You know what I mean?
Sure.
And the therapy,
Yeah.
They're getting destroyed.
So that's our other ING. So if you see people walking around the office with weird
things attached to
circles and cups
It's
attached
on,
to them, which you may see because we'll have we're going to start opening up the wellness room, I believe. We need a little more room, so we're going to open up that wellness room to have cupping and maybe some acupuncture as well.
This place is already like a MASH unit some days. You know what I mean? Like you'd never know that we're actually chiropractors.
The only thing we're missing is helicopters.
We got people's intestines coming up. We got it all going on these days, and our yoga studio is awesome. But during the day, we had yoga classes morning and night. So during the day, we're going to use that for our different therapies. We'll set up some really cool like privacy bays, and but it'll be really cool because it's a really big, wide open area. Vaulted ceiling, and just like our main office. So it's really going to be a really cool place for us to do therapies on you. And so the one I want to talk about is acupuncture. Acupuncture really in a lot more demand as the research has really kind of validated its existence. The Chinese traditional medicine. Acupuncture's been around for 2,500 years. I think it's either 10th or 15% of the people that have ever lived on the planet have come out of or been in China. It's a lot of humans. And so they didn't have the research studies or the MRI or the anything but what they had was people. So over time they refined their treatment. So Western culture largely didn't really stick around, didn't really do anything with acupuncture. But the first study they ever did was 129 countries. And 103 of them use acupuncture regularly. And so a 50% increase in the number of acupuncture between 2002 and 2012. So in 10 years, it went up 50%. And so the 2012 stats, 6.4% of U.S. adults have used acupuncture. And of that, 1.7 in the last 6 months. So, about half of the amount of people that traditionally have gone to chiropractors. So it's about 12% of the population comes here. Or that's what it was back in the day. It's probably a lot higher now.
Yeah,
now
so
that
what
I think
is that?
about it.
So that says something about either their inability to get the correct treatment everywhere else, and this is the fallback. But it should be one of the very first things, besides chiropractic, that gets utilized.
Right. So the thought, they didn't know how it worked for the longest time, and then they were able to put people into MRIs and stab them with the needles. And then they saw that the needles were lighting up parts of the brain. And so pain reduction, organ function, that kind of stuff all has an effect on the tissues. And it also affects some of the other tissues that it's not trying to affect. So is there an effect? Absolutely. Can they explain it? No. But, that's just brain chemistry at this point. There's just so much we don't know about the brain. But we're doing more and more and more. And so because it has specific and non-specific effects, sometimes people are like, is it the relationship with the needle? Is it this? Is it that? And it's impossible to say. But it is possible to say that acupuncture can produce some pretty great results. And so we're delighted to be able to offer it here. It takes a long time to get certified in acupuncture. It's like tattoo. You can get a tattoo artist, but, then you can get a tattoo artist.
Right.
And so same thing with acupuncture. Same thing with chiropractic. There's learning the discipline and then learning the art. And that's the limiting factor with a lot of chiropractors. And so acupuncture is the same way. So Dr. Drum passed her certification. I think she had to meet a acupuncture master and then defeat them.
Yeah.
It's a big deal.
It was evolved.
Yeah. Mm-hmm. Yeah. And so that's something we're going to be adding. So I just want people to know, hey, there's a lot of misconceptions out there about acupuncture, about how it's delivered, about, just rest assured, we've poured over the research on this, and we don't have a lot of room here, but we have a lot of patients. And so we're not going to add anything that doesn't give us quick, sustainable, consistent, clinical results. We don't have the time for it. And plus, we're always out there on the floor adjusting. If we're going to get yelled at by a patient, we get yelled at in front of 50 people. So if it doesn't work, it's not here because we can't afford that kind of time, and our patients rely on us. So it's just something for people to be excited about,
Do you remember that time that you received acupuncture during a podcast?
Oh, I did remember that.
Do you think we'll do that again?
Probably.
Yeah.
We'll probably get stabbed up.
Nice.
You know what I'm saying? Stab me up. I'm about to stab up some
Side
sandwiches.
note, when we talk about acupuncture and scraping and cupping, all of those are derived from Chinese traditional medicine.
Right.
Like they're all, it's not us like, hey, look at all this stuff we invented, guys. This is all stuff that we're using to help better our patients while they're getting treated chiropractically here.
Yeah, it's been around for more than a couple years.
Yeah,
Yes.
it's cool stuff. We're excited to bring it to the forefront. I know that like when Phelps, that like, oh my God, everybody was trashing cupping this, cupping, because it showed up in soccer, the World Cup that year, and Phelps, and they were like, oh my God, cupping doesn't work, cupping this, cupping that, just going off on it. And then lo and behold, they're like, oh yeah, here's some clinical benefit. And it's like, you guys really people need to,
Chill out.
like, calm down. They're losing their minds. Everybody got interviewed. They're on CNN. All these doctors are like, okay, the clinical yield is there. Is the mechanism understood? No. Okay, but that doesn't mean, it doesn't mean you can just dump on it. You don't know the clinical mechanism for Advil either. And you sure as hell don't know it for opioids. So maybe calm down, Anyway.
Chill out.
All right.
All right, for myself, Dr. Josh, Dr. Brad.
Have a good day.
If you'd like to email me, it is drmatt@mfwellness.org. Have a great one.
Meow.
A big thank you goes to Hug Monster Sound for all the hard work they put into making us sound so great.